Together we achieve victory over heart failure.
Hello everyone, I am Dr. Dilip Narayanan. I am a senior consultant at Wellcare Hospital, Kochi. Today we will be talking about monitoring heart failure. As we know, heart failure is a condition where the heart is unable to pump or meet the demands of the body organs. So it's very difficult to notice heart failure or worsening of heart failure right away. As our heart faces increasing strain, it compensates by working harder. Yet, as heart failure progresses, its ability to pump blood diminishes gradually, and over time, the subtle changes may go unnoticed, emphasizing the importance of recognizing heart failure symptoms. So, swelling in feet, ankles, or abdomen, along with sudden weight gain, are common signs of heart failure. Monitoring weight can also help manage the swelling, shortness of breath during daily activities, worsening dyspnea on exertion, and interruption in breathing due to persistent coughing or wheezing warrants medical attention, especially in patients with history of heart failure. Again, difficulty in sleeping or lying down may indicate heart issues. Fatigue, confusion, or fainting may also signal inadequate blood flow to the brain. Other symptoms like rapid heart rate, palpitations, nausea, lack of appetite also could indicate heart problems. So, if you notice any of these signs, seek prompt medical care. Now, let's discuss about key heart numbers. For example, blood pressure. High blood pressure is always harmful because it makes heart work harder and less efficiently. Fortunately, high blood pressure can be easily detected using a sphygmomanometer. Nowadays, digital equipments are available. It can be done easily by home BP monitoring. We should target a blood pressure below 140 by 85, and if it is above that value, it is said to be elevated. The next number you should know is your pulse rate. Patients, especially with history of heart failure, our target pulse rate is between somewhere between 50 to 70. Don't be afraid if your heart rate is between 50 to 60 on medications. Our target is to keep it below 70. And if it is very high, rapid heart rate or irregular pulse rate, you should always contact your doctor. Again, another number you should know about is your urine output. You may not be able to measure your daily urine output in patients with patients suffering from heart failure, even though some people they do measure their urine output, but you should have a rough idea about how much urine you are passing per day. And if there is a sudden decrease in urine output, you should always suspect possibility of worsening heart failure and seek early medical attention. Again, another number you should know is about sugars and cholesterol. Patients with heart failure should have good control of their sugars, like fasting sugar, preferably below 110, but at least it should be below 130. Postprandial sugars, preferably below 160 and at least below 180. And an average sugar for 3 months, that is HbA1c, below 7%. Again, similarly, cholesterol also, if patient has history of atherosclerosis, like history of heart attack or history of stroke, the target value is we look after is LDL. Our target is should be below 70 milligram per deciliter. So with this, monitoring all these parameters will help you in preventing further episodes of heart failure as well as worsening heart failure, so that medications can be easily adjusted to prevent acute worsening or even death. So this concludes today's discussion on monitoring of heart failure conditions. Remaining proactive is the key to safeguarding your heart from heart failure. Thank you. Namaste.